Hello and welcome everyone. In this video we are going to learn about the Diarrheagenic E. coli. We have already discussed three parts of the E. coli in which we have discussed about its virulence vector and all the morphology, laboratory diagnosis. In this video we will focus only on the Diarrheagenic E. coli, its clinical manifestation, pathogenesis and diagnosis. Let's go through it. Okay, first we will go through the introduction of Diarrheagenic E. coli. The strains of the E. coli that causes diarrhea, that produces diarrhea, are called Diarrheagenic E. coli. They are antigenically distinct from the E. coli that are present in the body of the host as a commensal. From the commensals that are present in the body of the host, they are antigenically different. There are 6 types of Diarrheagenic E. coli. First is Enteropathogenic E. coli, Enterotoxigenic E. coli, Enteroinvasive E. coli, Enterohemorrhagic E. coli, Enteroaggregative E. coli, and the last one we have is diffusely adherent E. coli. Now we will go through them one by one. First we will go through the Enteropathogenic E. coli. As the name suggests, it is pathogenic. It will neither produce toxin nor it is invasive. It is only pathogenic. It causes infant diarrhea. Now we will discuss about its mechanism of causing diarrhea. First, it will enter into the body of the host. It will adhere to the intestinal mucosa with the help of bundle forming villi and produce AE lesions. Okay, when it will adhere to the intestinal mucosa, it will disrupt its brush border and leads to the watery diarrhea. What it will cause? It will disrupt or it will destroy the brush border of epithelium cells, and which leads to the watery diarrhea. Increased secretion of electrolytes in water ultimately leads to watery diarrhea. Next we have is the Enterotoxigenic E. coli. As the name suggests, it is toxigenic. It means it will produce the toxins. It will not spread into the body. It is not invasive. It will only produce the toxins that will ultimately lead to the disease. Okay, it is also called traveler's diarrhea. Here some of the serotypes are given. Now we will go through its mechanism of action. First, it will attach to the intestinal mucosa with the help of CFA, that is colonization factor antigen, that helps in the attachment. Next thing is that it will produce toxin. First is heat labile toxin, that is called LT, and second one is heat stable toxin, that is ST. LT will increase the adenylate cyclase activity that leads to the increased accumulation of AMP, that is adenosine monophosphate, and that results in the outflow or secretion, increased secretion of H2O and electrolytes, and ultimately leads to diarrhea. In the same way ST work, that is heat stable toxin, what it will do? It will attach to the epithelium, intestinal epithelium, and it will increase the accumulation of GMP, that is guanosine monophosphate, that will lead to the fluid accumulation and result in the diarrhea. We have already discussed about these toxins in brief in our part 1 video. Okay, in this way it will cause the watery diarrhea. Next we have this strain as Enteroinvasive E. coli, that is also called EIEC in short form. It has following serotypes. Its pathogenesis. Now we will discuss about its pathogenesis. So as first as the name suggests, it is enteroinvasive, means it will not produce toxins. It will spread into the body of the host. It is invasive, means it will spread into the body of the host. Okay, let's discuss about its pathogenesis. First, it will adhere to the epithelial cell with the help of VMA, that is virulence marker antigen. With the help of VMA, it will adhere to the intestinal mucosa and produce the disease. Now what it will do? Manifestations are, it will produce the ulcers in the intestine. It may cause dysentery, that is related to bacillary dysentery. Okay, that resembles shigellosis. Dysentery means diarrhea with mucus and blood, that is called bacillary dysentery. Last thing is diagnosis. It can be diagnosed with the help of ELISA. Okay. And next thing is HeLa cell invasion assay, and the last is Sereny test. Okay, what we do in Sereny test? In Sereny test, we take the suspension of bacteria. Okay, we will take the bacterial suspension and we will inoculate that suspension into the eyes of guinea pig that will produce conjunctivitis. Okay, in this way we can detect this enteroinvasive E. coli. Okay, now the next we have is the Enterohemorrhagic Ecoli. Enterohemorrhagic Ecoli is mainly prevalent in industrialized countries and it is one of the most important strain of E. coli. Its serotype are given here. Okay, it spreads through contaminated food. Low infective dose means less than 10 to the power 2 bacilli are maximum or minimum to cause are enough. In the few words we can say that less than 10 to the power 2 bacilli are enough to initiate the infection. Next we will go through its pathogenesis. Okay, it will produce the toxin, that is virotoxin and Shiga toxin. Okay, Shiga-like toxin. Shiga-like toxin is divided into two parts, STX1 and STX2. STX2 is responsible for the development of HUS, that is. Okay, next thing is that HUS, that is hemorrhagic uremic syndrome. Okay, next we will go through its manifestations. Shiga toxin causes the capillary microangiopathy. Microangiopathy is a disease related to the blood vessels. Okay, it will destroy the small blood vessels. And next thing is that HC, hemorrhagic colitis. Now this enterohemorrhagic E. coli can also produce HC, that is hemorrhagic colitis. Hemorrhagic colitis is manifested as the bloody diarrhea, abdominal pain, but the main thing is that there will be no fever. Okay, there will be no fever in the host. Next we have is the hemorrhagic uremic syndrome. This is the injury to small vessels. It leads to bloody diarrhea, thrombocytopenia, that is the deficiency of platelets, without fever. There will be no fever in the host. Okay, next we have is the diagnosis of enterohemorrhagic E. coli. So we can use the sorbitol McConkey agar for the diagnosis of EHEC. So it has a different characteristics from the other E. coli strain, that is it cannot ferment sorbitol, whereas other strains of E. coli ferment sorbitol. Okay, it will produce pale colonies on sorbitol McConkey agar because it does not ferment the sorbitol McConkey agar. Next is rainbow agar. Okay, it will produce black color colonies on the rainbow agar. And the last one is toxin detection. For the toxin detection we can use gold standard methods and ELISA, etc. And the next we have is the enteroaggregative E. coli. Okay, so enteroaggregative E. coli, it is named because it adheres to the HEP2 cells in a distinct pattern. Okay, the pattern is named as stacked brick fashion. Next is colonization is through the aggregative adhesion fimbriae. It will colonize the intestinal mucosal cell with the help of aggregative adhesion fimbriae. Next we have is it will produce the EAST, that is yeast first toxin, that is also called enteroaggregative heat stable toxin. It leads to the acute diarrhea. Okay, this acute diarrhea is mostly seen in the developing countries. Okay, this is the strain that is responsible for outbreaks in Germany in 2011. Next thing we have is the diffusely adherent E. coli. It is characterized by its ability to adhere to HEP cell in the diffuse pattern. It also adheres to the cell, but it adheres in a diffuse pattern. That's why it is named as diffusely adherent E. coli. It also causes diarrheal disease in children between the 2 to 6 years of age. Okay, this is the end of our video. Thank you. We have completed the whole E. coli. Thank you. Have a nice day.